we're just about to get to what we call mental health 101 na nitugutukania ruthiomi nigetha gukorwo gwi kwega nitugutukania ruthiomi. I want you to share this with our friends. Yeah, I want us to share this with our friends. Andu aingi muno muno nitukwenda gushare ndeto ino mental health 101. Ni andu aigana hihi umuthi uyu? I'll give you the statistics shortly. Joyce Dirago, thank you very much mwena muhia. It feels nice to see you. Na mwena uri ungi ni ndona ndagitari umuthi twina full house. Riu ndimwitaga Mama John, but I'm honored to have Dr. Jen Njihia, who is just about to come in nigetha atuhutirie maundu manini. Introduction nikio ndoiga it is called mental health 101, and I want to take this opportunity to gushokia ngatho kuri Dr Paul ni tondu wa kurugamirira uhoro wigie ugima wa mwiri thiini wa the trumpet of hope. Actually nowadays we are calling him the trumpet doctor. Turamwita the trumpet doctor. Ugivatara guthondekwo muone kando, ugivatara kwaria kaundu kegia ugima wa mwiri muhurire thimo, ni egugutumberia na ni egukinyukithia makinya maria magirire. Hey, share this now with one or two friends, and right now I bring in the doctor wa usiku wa leo. Karibu sana 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 sana. I feel so honored. Gwiciria umuthi kungiheano iheo ni ri gukorwo ndi wa mbere kuheo kiheo ndikana ri ni rita riaku ria mbere, but thiini wa history ni gwiciria umuthi ni muthenya munene muno guthiete kinya gwatuika ati ni waingira thiini wa trumpet of hope. Oh my goodness.
How niguo niguga ni wabunja rekondi.
Karibu sana ugeithie muthikiriria, have time to introduce yourself, andu makumenye nigetha tucoke twambiririe trumpet twambiririe horo wa mental health 101. I feel so honored. No ndiramenya ndagitari hau ni tondu wa gukuhe kindu gitagwo motivation.
That is very true.
Yes, welcome. Introduce yourself.
Thank you. We mwega muthikiriria wa Trumpet of Hope. Haria hothe murathikiririe hwaini wa umuthi. Maritwa njitagwo Jen Njihia. I'm a family nurse practitioner, and I am currently working at an acute care psychiatric hospital, managing psychiatric patients. Na hwaini wa umuthi ni tugukorwo tukiaria. We're just going to be doing the introduction. Yeah, what mental health is, na tuhutie hanini some few diagnoses here and there, and also we'll be talking about where to find help. Na nituguthi na mbere kwaraniria how tukimenyaga maundu maingi manini maria tuwi, na nitugukorwo tugicokia ciuria o hau, na koguo thie na mbere na gututhikiriria no korwo ri hamwe na ithui, and I hope that you will learn from this process.
Thank you so much. Nigukoretwo kwina maundu maingi muno maritio thiko cigano na thiru kuma riria andu mambirie kwaria horo wa COVID-19 gutuika kwina cases cia mental health kuma riria twambiririe gukura ona history, tukiambiria kuigua andu ni maratwarwo mathari, tukaiguaga mundu ng'ania ni aragurukire, tutimenyaga mental health ni ki. So umuthi ni tukwenda kumenya, na no tukwenda kumenya uria tungika ta community kana ta society muingi nigetha tuteithie andu mena mental health. Ona tumenye kana hihi maundu mamwe maria tureka ri turameka ni tondu hihi hena thina handui kana ni tuguvatara kuona ndagitari symptoms, maundu macio mothe ni tukurora. So reke twambe twambiririe na riri hindi turagweta kiugo mental health. What is mental health?
No wega ni kuria kiuria kiu na nigukorwo gitukania thiomi niguo tuhote kuiguana.
Yes.
Define mental health. Mental health is the level of psychological well-being or the absence of mental illness. Ugo ni kuga ati ni urahota ku function wega, ni urahota ku handle situations as they come, na ni urahota gukorwo meciria maku makinyanirite niguo no gakorwo ri no gima wa mwiri undu ati ni urahota ku make the right decisions. being mentally health, it affect our emotions. It also affect our psychological being, and also our social being. It affects how we think, how we feel, act or behave. It also determines how we respond to stress, especially at this moment when the COVID-19 is going around. How are we responding to this stress? How are we relating with the other people? Mental health also affect the choices that we make. Mm-hmm. Make any choice. It's all affected by your mental well-being. Mm-hmm. If you're not well mentally, you're likely to make the wrong decisions. You're likely to make the wrong choices. So mental health, it affects our feeling. It also affects our thinking, and it also affects our well-being or behaviors.
Tareke Julie, todo within a practice yeo, why is mental health important? Kurigana na maundu macio wagweta. Is it something that we should think about? Is it something that we should take seriously? Is it important? And why is it important?
To answer your question, mental health is very important. As I said, it affects how we feel, how we act, or how we behave, or even our thinking. When you're not thinking right, you're not going to be making the right decisions. Mm. When your feelings are affected, you're going to be, it's going to affect your whole being. It's going to affect your social being. Mm-hmm. How are you relating with others? If your act or behaviors are affected, it's going to be affect how are you making decisions. And that's where it comes, like, okay, when your act is affected, that's when you behave, you start thinking, okay, I can commit suicide, I can do this. It makes you have, you just make the wrong decisions. You have the wrong social, what do you call it? Your company is wrong. Mm. It influences your behavior. It influences who is around you. It influences everything that you're doing.
How do you tell when somebody has a mental illness or is mentally unhealthy? How do you tell when somebody is mentally unhealthy?
So we have defined what mental illness is, what mental health is. On the other side, when you are affected mentally, you have the mental illnesses. And it's a wide range of conditions that affect the mood, thinking, and behavior. And when you're talking about that, we have so many diagnoses ranging from depression. We also have anxiety. We have personality disorders. We have the dementia. It comes in there. We also have the substance abuse. It also comes in there. And so many other diagnoses that we have.
Wow, thank you so much. Turaria uhoro wigie mental health 101. This is an introduction to a very serious and important issue that we need to discuss. Nidratanya dagitari ni egukorwo akihutia kana akiongongerera hakorwo hena kiuria. Riu ndiramenya uria guguthie nigetha muhote kuiganira hau uguo muri inyueri, but whenever he is saying something I am so excited. I want to tell the people who are coming in. Yes, Daktari, how are you?
Doing well, thank you.
I can see how joyful you are today. Now see.
I'm overjoyed.
By the way, ni tondu wa muthikiriria nhevata wa kumenya ati andu aria turaria now, the trumpet doctor himself is Dr Paul Kuria hau, na niwona Mama John New namenya rie ujitekeria tujuge Mama John, but for today that is Jen Njihia, and she's an expert and in what we are talking about. So Dagitari Paul Kuria nitwagweterwo ni Mama John the issues that mundu angimenya uhoro wigie mental health, nitwerwo mental health ni ki na twerwo uria ihana na hena kiuria doria na no nyende hihi wongongerere the importance thĩinĩ wa society itũ the importance of thinking and discussing about mental health and even taking a step as a society, as a family, as a community, as a church, and even as an individual. Why is it important?
Very important, Bwana Captain. Mental health. Ona kuma tugikura. I think if you remember very well, ithu tuene kuri murimu mental health higwa tuenaga arimu makiguruka. Like my wife always tell me that kwe mwarimu wao wokaga na tothi kana ngwaci imwe na arenda magayane yothe, like a class of 40 people to share tothi. You see, so tuonaga mental health can manifest in those ways. Like a teacher would of course would manifest signs of depression or signs of psychosis. And I know my wife is the expert in there. She will expound on that. But it's very important. There is a stigma that is attached to mental health that keeps us from not wanting to discuss mental health. Now, mental health in a way, I think also, if you think of it, even developmental disabilities included in mental health. And what happens, like you remember back home, we have had cases ciando mohagwo nyumba mwana agaciarwo agatũrwo hagwo nyumba nigetha ndakoime. Koguo it's very, very important kumenya ati mental health is a disease like any other. Murimu wa shukari, murimu wa thakame, mirimu ino yothe, even heart attack na stroke na the mental health is just as similar to such. Not just the same way that we admit that we have hypertension or high blood pressure or diabetes or stroke or those other diagnoses, the same way we should accept and discuss mental health. Because the data is showing there that, of course, mental health is also taking away our people. So it's very important come discuss. Part of it to create awareness nigetha tuhote guteithia society.
Tareke tuke turore uhoro wigie diagnosis.
Yes.
How do you go about it? Mudo na nidamia ni mithemba mingi. Rudi kana tukambiriria kwamba ku point mithemba ya mental health issues kana tuguthi hari diagnosis. Which one do you prefer, daktari?
Gwiciria muthi no tuhutie hanini uhoro wa depression, which is affecting most of us, and especially hi dalili ria COVID.
Yeah.
And it's also affecting our community. Ugakoraga people are committing suicide, people are doing things that are not supposed to do, and most probably they do not even know that they are depressed or they're dealing with depression. Koguo no nyende tuhutie hanini about depression. The other things ni maundu maria gugwetete uhoro wa anxiety, ukaiguaga you are at ease, ugakoragwo you have that feeling that is within you. You feel restless, you feel agitated. Na no tugie na kamweke kangi hindi ingi turiaria uhoro wa maundu ta anxiety, uhoro wa PTSD, uhoro wa attention deficit disorder, uhoro wa OCD, obsessive compulsive disorder, na maundu mangi maingi ta mau no tuthie tukihutagia uguo. Na nigwenda kugweta undu mwe he undu mwe Paul auga uhoro wa stigma ya mental health. Nĩ njĩraga andũ ona rĩrĩa tũramatreat thibitari, nĩ njĩraga andũ we are all prone to this. Gũtirĩ mũndũ ũtangĩrwara ũtangĩgĩa na mathĩna ma mũtwe. And I usually tell people, see it as one of your organ that is affected, which is the brain. Nĩ tũhotaga gũteng'era mũno hĩndĩ ĩrĩa ngoro ĩtararuta wĩra wega na andũ magateng'erio thibitarĩ. Nĩ tũteng'eraga mũno hĩndĩ ĩrĩa mũndũ atuĩke diabetic na andũ makambia reke tũrĩe wega, reke twĩke. But when one has a mental illness, we are most likely to judge them na kũmona tarĩ an outcast kana ta mehĩtie kana ta mekĩte ũndũ out of the ordinary. But nĩ ingĩenda andũ kuma muthenya wa muthe unyite wone atiriri, it is just an organ. O toria ngoro yaku ingihutio ugie na blood pressure. O toria sukari waku ungituika ni urathi iguru na ugathie thi. O toria ungikorwo na any other illness, any other disease, mental health, it's a disease of the brain. It's your brain that is being affected, and that's why you're reacting the way you're reacting. So take it as it's one of your organs that is not functioning how it's supposed to be.
There are so many myths about depression na nituguthie gitaruraga kamwe kamwe, but right now let's go to the depression and uria mundu amenyekaga kana the symptoms mundu na depression.
Depression, it's characterized by persistently feeling down, feeling depressed. Ukagia na loss of interest, mundu rendete gwika maundu ukonaga mundu ucio ndarenda gwika maundu, agakorwo so inactive. Na ni kuri maundu maingi muno makosaga depression, which include biological, psychological or social stress. All these things, they cause changes in your brain functioning, and they may include altering your activity of certain chemicals, or we call them the neurotransmitters in your brain. Icio nicio chemicals iria itumaga ukorwo hey ni uraigua we mukenu, ni uraigua we murakaru, ni urahota kuhandle maundu wega. When there is imbalances in those neurotransmitters, ugakorwo your brain is not functioning as it is supposed to be. Symptoms iria ingiuga cia depression, number one is check for the mood. Mood may present mundu ucio agakoragwo ena anxiety, ena feeling of guilt, ni arecuka akaiguaga ta tagireire. I don't know how to express the guilt. Mundu roigwe na guilt. Alafu mundu ucio no akorwo ena feelings of hopelessness, araigua maundu mothe ni akinyite mwico, I cannot do anything, this is the end of it, and they feel so hopeless. Mundu ucio no akorwo ona ena kindu twitaga loss of interest kana anhedonia, maundu maria rendete gwika kona mundu ucio ni ndiramwiraga tuthie hana na ndarenda, ni endete gwika undu muna na thiku ici ndendaga gwika. That is the mood changes in the person. The other thing is the behaviors. Tauria jugire, it affects your behavior. Behavior is like how the person is presenting themselves. Are they agitated? Mundu ucio ahota kumwariria kaundu kani alipuke. Or maybe they become so they have excessive crying. Kaundu kanini kaundu agirahotire kuhandle no woka akambia kurira. Kana onaria kaundu kanini, they are just crying. They also become very irritable, and they may also withdraw. Those are the behaviors that you're supposed to look into a person. Wona mundu rendete kumira kuri andu ni ejitenga, ni ambia kuyeheria, ni ambia kuikaria, ndendaga kuma nyumba, ndendaga gwika, ni arathiaga kanitha, ni atigire guthi kanitha, ni arathiaga ciama cia atumia, ndendaga ku associate nao, ni eikaririe. That is also another sign. Ohoro ria ungi ni kurora their sleep pattern. How are they sleeping? That may also tell you a lot about their depression. And it could be either way. Are they sleeping too much, or are they not sleeping? They could be having something that we call trouble falling asleep. Mundu ucio athitoro ageria gukoma atozaga na hihi rucini rugakinya atari arakoma. Kana hihi ni arahota gukoma ingira toro aingira riria agakoma, but agokira, which we call trouble staying asleep. So you also need to consider the sleep pattern. How are they doing with their sleep? The other thing is their weight loss and their appetite, the weight changes and the appetite. Depression will cause you either to eat too much or not eat. And so when you're eating too much, you could be gaining a lot of weight. When you're not eating, you could be losing weight. That is also another sign. Slender, they're not taking care of themselves, they're just eating anyhowly. It could be they're depressed and you do not know. Or maybe somebody who who eats and now they're not eating. that also could be another sign. And the other thing is cognitive. It may affect your memory. You find people lose concentration. They are not able to focus. They are depressed. That is another thing that you need to look at. And they become slow in doing things. Walking style yake. He's just very slow in everything that they are doing. And the other thing in the cognitive, it also affects your brain chemical and you tend to be suicidal. Hau niho andu makinyaga mundu akaigua ni arenda either you become homicidal or you become suicidal, which is suicidal is you want to kill yourself, homicidal you want to kill others. And I think those are the major signs that we need to look at when we are considering depression.
Thank you very much. Twĩ thĩinĩ wa bũrũri wa USA thaa ici na kũringana na marivoti marĩa mekuo 16.2 million people adult had at least one major depressive episode in the year, and it has been increased kana nĩ cingĩhĩte mũno nĩ tondũ wa mĩrimũ ĩrĩa ĩkoretwo ĩkuo na gũtuĩka andũ me thĩinĩ wa quarantine, gũtuĩka andũ matirĩ na mawĩra, maũndũ megiĩ ihiko kũringana ũrĩa tũciũĩ, some unmet desires cia mũtũrĩre, ciana nĩ wathomithia kana nĩ weka maũndũ macio marĩa mothe ũkwenda gwĩka and then citinakinya harĩa mũndũ ekwenda, maũndũ macio nĩ maingĩhĩte mũno. Then andũ makaga kũmenya where to put a line gatagatĩ ka gũthiĩ kũhoya na gũthiĩ gũcaria ndagĩtarĩ. Tũgeciria hihi mũndũ angĩrwara ngoro nĩ egũteng'era thibitarĩ, no agĩkore na mathĩna ma meciria ndangĩteng'era thibitarĩ. Maũndũ macio nĩ maingĩ mũno. Tareke tũke rĩrĩ ndagĩtarĩ, na hihi no ũrore haha ũguo, who is affected, na no nyende ũhinyĩrĩrie haha nini tondũ rĩmwe twĩciragia ciana-rĩ, are they affected by depression? Andũ ethĩ-rĩ, are they affected by depression? I don't have the statistics yet by now, but according to what I see, what data, there is some data that shows the ages or maybe the people who are affected by depression. Tatuhuteria hanini kulingana na hihi uria ukionete.
Depression may affect anybody on a ciana nini, but how they react may be possible, may be different with how adults react. Now, mostly when the kids are being depressed, they tend to isolate. They tend to withdraw. Mwana ũcio ũkonaga nĩarenda kwĩikaria, enda gũikara rumu yake, kana hihi ona rĩrĩa mena ciana iria ingĩ mangĩkorwo magĩthaka nacio. Ũkona mwana ũcio ndarenda kwĩ-engage in activities, arenda kwĩikaria, no ndangĩhota kuga ũrĩa araigua. But the feeling of kwenda gũkorwo isolate, kwenda gũkorwo withdrawn, that is a major sign in children. Some kids may be able to verbalize or say, hey, they're down, but other kids may not be able to say it. So when your kid's behavior changes, hĩndĩ ĩrĩa mwana waku ũrona nĩambia kwĩikaria, nĩarendete watch games, ndarenda watch games icio, nĩarendete gũthaka na ciana iria ingĩ na ndarathaka na ciana iria ingĩ like they often do, then you ought to pay attention to what they are doing and make sure that they are seen for that.
Daktari, I don't know whether you have anything to add so far. I know we are coming to the issues of stigma and the society. Ndikana he ũndũ ũngĩenda kuongerera harĩ maũndũ marĩa twagweterwo oro wĩgiĩ the symptoms iria ciagwetwo nĩ ndagĩtarĩ, and maybe you can add something.
If I would say something, no gucokera muno na hinyiririe na reke njarie na gikuyu nigetha mundu wi hau aigue. Gwiciria undu uria munene muno tuonaga na mundu akigera gacira kau ga gutuika depressed ni uhoro wa kwaga kindu gitagwo self worth, ukaga bata waku we mwenyewe, ni tondu ringi wa kuhinyiririo ni maundu kana koguo my wife warakiuga uhoro wa the chemical imbalance, no tutigwete uguo serotonin and dopamine and other chemicals in the brain that become affected. Let me talk a little bit about the young people. the young people, they might affect women. Let's see, the reason why they are getting affected is that they let's say like the synthetic marijuana. Synthetic marijuana, it's actually making them lose it. Now we have treated quite a few cases synthetic marijuana and also vaping. Vaping is actually before even COVID-19. I think vaping was almost becoming a pandemic. Because they are sniff kind of whatever.
They smoke, they sniff.
They sniff, they snort.
They dab, they snort. You have to understand their language.
And it's more like anything. Kahawa mashani. Maundu macio mothe. Riu na icio cigathi ika affect meciria mao. I think recently I saw a 21-year-old somewhere. Of course, I was taking care of their medical needs, not psych. My wife is expert in that. I do medical. But this young man apparently used something that I don't know what it was. No, ikimuhe kindu gitagwo grandiosity. Akiona we ni ngai. Agithie handu homeless kimwana kia muthungu kimwana gia 21 years agithie ku hagikora mutumia mukuru muno wa homeless agithia akimumunya, I mean kissing mouth to mouth. Homeless mundu akora uguo ati orio niki akigua ati aigua amuhe muoyo. I need to give this woman life. No igwa riu ni aguruka riu agacoka agathie ni aguka wathie kumwariria arenda gukuhoera of course arakuhoera agikwiraga we niwe ngai, he himself niwe ngai. Riu gakora mundu tocio no amiaka 21, but again what is affecting them the what they are using. So muno. Now this is maybe tugenda kwanira muno kuri aciari. Uhoro wa kuonaga mwana o muthenya nigetha ukarora kana ni kuragia na mitugo iracenjia. Riu toguo turaiga haha ati aiko mwana aramenyerete guikaraga na aria angi, especially teenagers, nona ni ambiriria guthie kwe isolate. Urona we yathie ni arathie kwenda kwikaria araikara nyumba rumu gwake arenda kwaria ugacoka ukarora. The other thing I think my wife did not mention that ni hygiene. Mundu uramenyerete gwithamba wega na mundu uramenyerete kwihumba wega ukona ni atuika careless. Mundu uramenyerete kuiga rumu yake straight ugakora ni kwagia na tuthina rumu ihana so to speak ihana kioro. Mundu uramenyerete gukorwe na mubango utaratiraga cukuru ukona ni ambiriria gutira cukuru. Arathi akigiaga na tumaundu ona tutiokaga. Those are red flags iria twagirwo ni gukorwo tukimenya, and those are some of the basic signs. Na to ciana cika ona andu agima icio ni maundu mamwe twagirwo ni gukorwo tukirora na tutige gwitigira gwicira he handu waiga ati kwambiriria kugia na tumaundu tatu uguo ri twambagiriria of course twambagiriria gwika ati twambagiriria kunegena tukambiriria kuhoya na mahoya ni mega no he handu hakinyaga he handu hagikinya counseling yendekane he handu hagikinya counseling yendekane tondu riri na ungiona mwana ni athie ni acenjia muno na ni urona riu urageria kumwariria na ndui you're not even sure what they are doing tondu amwe urageria kumera ona wamariria kona matiri undu marenda gucenjia na uria wothe wageria intervention iria ciageria we ta muciari ukaremwo ni wega gu seek help ya the specialists. Tondu imwe toguo raigua some of this depression happens ni tondu wa chemical imbalance. When there is that chemical imbalance, there has to be medication intervention nigetha twike ate nigetha tucokie tugerie gucokia rui mukaro nigetha tuigire ku mutwe wa mundu tuguthie chemicals irageria gutuika imbalance tucicokie haria ciagirire nigetha mundu acoke depression itige guthie tondu I mean we're only talking about depression no but again you see those are very basic that's very basic but when it gets worse then we see of course we see maundu moru magekika lukugo ni wega arrest depression itana kiruka tondu ya kiruka niguo guthukaga.
Thank you so much.
I mean, in my let me just add this. Ndiciragia ni in my kirena netu uyu gutiri mundu kagira rucini urari mukenu kana uraturite na gikeno agathie kwita. Gutiri mundu kagira ogwo akambiriria kunywa dawa. Those are the suicidal effects as a result of prolonged depression, that feeling of helplessness. Nikio gitumaga andu mathie mundu akenda kwiruta muoyo koguo ni wega kumenya some of those signs nigetha tugateithia andu gutana kinya handu tondu I mean depression is taking away a lot of people.
Thank you so much, Dagitari. Ni wahutia maundu mabata muno and it triggers so many questions in our listeners. Aikorwo wina kiuria ungienda kuria no hure thimo kana the best thing is to call us na thimo na ni tugukenda muno. You can call us on our phones namba icio ndekira hau 936 661-3388 kana 978-227-6484. Iyo ni icio ni raini ungihura thimu na ni ukuhota kuria kiuria. I want to say something. Depression is the leading cause of disability in the United States among people ages 15 to 44. This is according to the National Network of Depression Centers, USA. These are facts. Depression ranks among the top 3 workplace issues in the United States, along with the family crisis and stress. This is researched and peer-reviewed documents. Suicide is the second leading cause of death for the ages 15 to 44. There is one death by suicide every 12 minutes in the United States, and 42,773 deaths by suicide in the United States at a particular year. Na rivoti eno hei yao ta ukoro ya batete 2020 ni tondu wa maundu maria makoretwo mathiete ho. Hena mundu woria uhoro wigie postpartum depression, because that is something else that people don't understand and they don't know, and especially kuria mucie guku US DOA no mucie ni kuri andu aingi muno twanaigua ni magia na depression thutha wa kugia nda kana kugia mwana. Tahutia hanini uhoro wigie depression iyo onayo tondu ngwiciria ni kaundu tutegubatara kundeka na mirengeti.
Thank you. Postpartum depression ni depression iria inyitaga mutumia arikia kugia mwana, ugakora ni agia na mathina ma mutwe to a point amwe twanaigua managera ciana ngero kana makegera ngero, and most probably or most likely cause of postpartum depression ni chemical imbalances after going through the process ya kugia mwana. And something else that also play effect in that ni gukorwo mundu darahota kujangu maundu maria enamo, especially having a newborn na kegwitikira care darahota gukoma uria agiriire ni aikara week mahinda maingi ni undu wa mwana, na riria hihi afatie gukorwo agikoma ena twana tungiagirwo ni gutikira care ni araruga ni areka maundu maingi uguo ugakorwo mutumia ucio darahota gwitikira care. Eventually maenda mutumia kagia na depression ni tondu wa maundu maria agereire, na that is something that needs to be taken care of and to be taken seriously ni tondu it may cost the life of the mother and the life of the child, na twanaigua maundu ta mau mahanikite. Riria mutumia agia na mwana ni wega gwitikira care kana kwimenyerera. Ni tu encourageaga na tukona riria twanagia ciana atumia tukerwo when the baby sleep take a nap then. Tukae gwiciria maundu mau mangi mothe mauma nyumba kana indo ni iri thambio. Hindi yo mwana akoma ri nawe koma. na niguo he brain yaku time to rest and to heal. Ũndũ ũrĩa ũngĩ rĩ, nĩ kũheo ũteithio nĩ andũ arĩa maikaranagia nao. Do you have a sister that can come and relieve you for a minute to take care of yourself? Go get your hair done, go get your nails done. You know, having the self-care. Kana okorwo nĩ mũthuri waku kamwĩra njikarĩra na mwana, handũ ha mũthuri atuĩke no ũrathiĩ kũgũra indo hingo ciothe tondũ nĩ ũragĩire mwana rĩ, no, mũtige na mwana, teng'era nduka. By then, just going to the store, you're doing your brain a great deal kwamba kwehera in the current situation that you are in, na ũgathiĩ ũkona maũndũ mangĩ that could prevent depression. So self-care in women after childbirth is very necessary.
Wow, thank you so much. Nĩ tũkwenda gũka na no nyende angĩkorwo kwĩna mũndũ wĩna kĩũria no wandĩke kĩũria, ndimenyaga guoya wa kũhũra thimũ rĩmwe na ngwĩciria nĩ ũthiaga ũkanyithanio na stigma kana kũrĩa tũrĩ or something like that. But if you can write anxiety.
It's anxiety. Yes.
If you can write the question, I'll ask. If you can send the question as an SMS, I will ask. Taribu cio watu makiuria kiu kigie postpartum.
Postpartum depression.
Yeah.
Postpartum.
Yeah.
Postpartum. And riu taribu cio wandika kiuria te kiuri ni ndingiaririkana. No no at least ni adirikania kana ni anyonia kana ni oria kiuria. Warega kuria kiuria ri riu uricokaga ugathumbuka na kou. Tareke turore the advice iria ungihe society muno makiria ni tondu wa uhoro ucio wa atumia riria magia atwana, tondu ucio ni undu ukoretwo ukinyarira andu. Mutumia athire akiuraga kana na ni hindi gaciarwo. Andu aria mokire makiuraga mutumia ucio.
Oh no.
Because they don't know ati tikwenda gwake, it's a disease. So I don't know, ugiuga atia nigetha tucoke guku riu turi US.
Hari hau ni kucoka kuri family members to pay attention, mundu ikare mukiroraga mundu uyu maundu maria tugire maroragwo niguo menye mundu ni depressed. No urore behavior cia mutumia ucio, okorwo ni muthuri wikare ukiroraga mutumia waku, how are they behaving, bareka maundu atia nyumba. There are some signs that could tell you mundu is not normal. It's not normal gikora mutumia agitukania mutu mai-ini na tikuruga araruga cabaci. It is not normal gikora mutumia agika maundu out of ordinary. And if you find anything that is iratuma wicirie mutumia waku dara function uria agirwo ni gukorwo aki function, seek for help. Aria na ndagitari wake, aria na mundu ungimuteithia na niguo seek help, uheo teithio gutanathuka, tondu the more depression yathiĩte uria my husband augire, o uria iraga gutekerwo care early noguo mundu athiaga agithukaga, na noho meciria mukaga ukakora mundu agigia na citaga psychosis. Ni ugukora mundu ni areyariria, ni ugukora mundu ni araigua migambo, ni araigua kiaririo na gutire mundu ramwaririo, kona akihura nyumba ika tondu ni araigua migambo no we ndurameigua, ni arona indo thingo-ini no we nduraciona, na muno ugakora mundu ucio ni aratuika suicidal, araigua kwenda kwiyuraga ni tondu wori araigua thiini wake.
Undu ungi hau gwiciria tungiaria riri tuge ta men, there are some things maybe ungikora mutumia na wana rigiona gicagi, mutumia ni agia mwana ndari atari na mundu wako ikwa kumuteithia, ugakora ndika ni urakora mutumia gitambaya uria kiohagwo gikundo kina guku thutha ni kihugukire gitambaya gikundo kimwena, acoke kirire nguo nginya ni ndaruku ni ambiriirie kumikundika ikuria marima-ini, you know, ata utanathie nginya gutukania kana kuruga ngima na mai matare matheruku ni tondu ni ku ni akigurukire muno. But anyway, maundu maria mekuo no riu kiria kinene ingenda kuga on the side of men ni riri go support ya kiria tutige gukorwo ati no uhoro wa gukihanda mbegu no riu kwamera nagwa kigia kamundu ni kura turora. I think that is a major thing. Tukiragia uhoro wa chemical imbalance, also the support. Na support tondu menya atiriri ugitara mundu uramenyerete kuma mucii uguo kana agathii urienda akahinga nyumba enda guthii utuko wĩra na kĩ kana maũndũ marĩa arenda gwĩka nĩ atigwo rĩu ũguo haha hena kamũndũ ategũtigana nĩ aga support arageria gwetha nginya kũrĩa arathiĩ maybe ararĩha daycare more than they are making maũndũ macio nĩmo marehaga kĩrĩa makarehe stress tondũ mũndũ ndarĩ na support ĩrĩa arenda oka mwana nĩ arĩrire like if we talk about our youngest was waking up every 2 hours every 2 hours nĩ arokĩra rĩu ũngĩciria mwana ta ũcio korwo atĩkagĩrwo kĩa nĩ mũndũ ũmwe rĩ it would be easy to get depressed. I mean, there is a time that gĩirwo mwana akĩrĩra mini ngĩmũiga hau ngĩmũrekondi ngĩtũma message ngĩmwĩra what can I do with this one? I mean, he's crying uncontrollably. Nĩ mũcenjie nĩ anyuĩte iria akahũna no kũrĩra ararĩra hau ũguo. But you see, ũngĩciria ko nĩ mũndũ ũmwe ũraruta wĩra ũcio rĩ ona nĩ ũgũte mbaũ no rĩu kũngĩkorwo kwĩna support rĩ you see that will help ĩta gũkorwo you know even a type of respite care or respite or whatever you can call it.
That's a good one. Go put your clip kau.
I think I have it in one of my old phones because I mean I recorded and I sent because the kid was crying uncontrollably. I mean,
I offered help.
Now that is the secret. Now, where do you get the energy? You are not there, but you are able to offer help. Do you know? There's some energy. Only God knows, yeah?
Yeah.
Now, reke toke handu heho hegie riri. I don't want to concentrate so much on the triggers because I know maybe along the way either nitwahuti horo wa the triggers iria citumaga mundu atrige depression na eke giko, but I would want us to concentrate on some questions here. Na agikonio kuhura thimu no wega, and right now my phones are open. Ndamya hena do erimageria kuhura thimu, the lines are open, you can call. But there is a question. One is Bernice Karaoke, who is in Washington DC. Daktari, there's an influx of suicide among young Kenyans in the US. What is the role of the community to support young Kenyans possibly suffering from mental health illness? Secondly, are there mental health resources out there specifically for Kenyans? Ugishokia kiuria kiu kia Bernice re. No twende tumenye the line between spiritual care aterekei tohowe and when you need to seek real medical care apart from kugarekei tohowe nitokei tumuhoere na tukamuigirira moko na horiria ugubatara kuona ndagitari. The thin line between the spiritual and the scientific.
Let me address the issue of the influx in suicide among our people and probably the role of the society. Together, Jennifer Adil where to draw the line between mahoya na seeking help. I think all of us, we all know that this is not the America that we were told. Ino tio America ere twerirwo tugoka ino tio ere tu. Ino guku tikuo twerirwo. Twerirwo America wokaga utuage mbeca kana ugatuaga mbeca haria mahuti-ini. Ngĩũkanie ndeciragia atĩrĩrĩ na njuge been here for 20 years. No ngĩũkanie ndeciragia tondu athungu matiendete guthambia cioro ri ni ngoka ngathambĩria mũthũngũ kĩoro ona ndĩha ndora igana icio no njega. That is America I was coming to. Ndokaga ndaruta tondu athungu nĩ atheru na mena mbeca, ngoka ngamũrutĩra wĩra wa yard work, ngaruta harĩa yard work akandĩha kĩndũ kĩnini mũno ta $200 kĩndũ just kĩrĩa kanyamũ kanini ũguo tu ngeka. But you see, rĩu hingo ndokire gũkũ rĩ gugakorwo tikuo kuri ugakora kwena riri the society that when you come especially kuri andu anyu ri ugakora you do not have the support that you deserve. How many people mano kago kumeretwo ni mekuhost ugakora mundu ni aikirio ja ni andu ao. How many people mano kago kumakinya gukuma thimwe kahorio. You see, so there is those things that are, of course, are triggering depression, especially young people. Riu ugiciria horo wa mundu mwethi ni akoragwo na thina tondu mati supportagwo. Anything mundu mwethi ekage koragwo tuonaga tari rebellion. Riu makaga support, makaga mundu wa kumariria. Think of it. Riu ni mwana wa miaka 18 ni mwana wa miaka 20 or 23 mundu munini ucio okatiga nyina na ithe okago kubururio we mathina mao. Ringi mwana ucio reretwo ni maid doi ginya kwihurira nguo na doi kuruta wira ni atia ni oka ni erwo ginya cukuru no ginya arihe nena okete na I20 akerwo hihi wa okondo kuriha cukuru you're going to lose your status. Maundu macio magoka riu nimo maraingiha uguo magatuma. I think in my opinion the stress area iho ni iratuma kugie na increase in suicide. The community as a community nire turaigo horo wa ku identify ado personally goku dana koro I've dealt with lots of young people. Na even gwiciria andu aria manjuita cikomwangi manjui gidiru na the youth. Na youth, the reason why I was dealing with the youth ni komahe matu ti undu munene orenda ona ti besha mendaga kana ki. You just want to be there for them. Makagia na handu mundu angioka kana mundu angiariria kwagia na thina tondu witagwo problem shared is a problem half solved. Ogoko mukaria nao ukama accept no cio niguo koragwo niguo teithagia ndu. So the role of the society nigetha tunyihie suicide na ginya tuhote kudina depression nigu create a platform where the young people acio mara affect not only the young people but creating a platform that you are available for others, creating gukorona na nithuothe myself gakorwo they available na gakorwo na I mean I'm available na de na andu me available for me, that if I need to share something then I have somebody who is available that I can share with. Na gakorwo na if somebody want to share something that I'm available they can share with me. Yes. Kugo nego support na ku accept. I would say accepting especially the young people. Andu ethi ni twamona ri ni tutigege kumona kumanegenia. Let's try to understand where they are coming from. Na ithuothe turirikane atiriri twari andu ethi kwi maundu maria twagerire na some of us na mamwe twekire tutingienda mamenywo tondu he maria twekire. Kugo we understand you na ithuothe twari hau nigetha tuhote kuhe andu support. So the society need to accept the young people and we need to avail ourselves to counsel them, to support them, and to support them in whichever way. In always to come in especially they may not need your money, but they may need your presence. I mean, there's a lot we can talk about the young people, but again, I think that is a topic for another day.
Thank you so much. And by the way, Daktari, I recognize the work that you do. Muno makiria thini wa the society area uri, and like I told you earlier during the day, andu aria othe magukuhagiriria no nginya ndimere ati me na kindu kia bata muno kiria mabataire gukorwo makihuthira, from the church to the community to the school area. We are just so proud of you, and thank you so much for the work that you do. I like it the way you open your doors for all of us to come tukegangara kuu uguo mundu agekoria kuona kwagiriire akiuma kuu agakorwo muhonu, ringi imana mathina make mekumuthumburaga, but akiuma gwaku akoragwo muhonu. And we are so happy for you.
It's out of experience ijuge ogwo ni kwiragwo ukanywereire niwe wiki
karirita
Ĩni na muikari mutigĩtina no wĩkaga atĩa
ano wĩkĩrĩa thambo ĩrũmarũmaga
ĩni rĩu koguo maũndũ ta macio ũguo, so we've been there, so nĩtũĩ bata wa gũsupportia andũ arĩa angĩ. Now we have seen it work. Just like less than 2 weeks ago, I met somebody who actually told me, thank you for opening your house. Now he's a married man, doing very well. But again, he was like, we didn't have anywhere to go. But we were happy that you opened your house for us.
Thank you.
That is what keeps us going. Jenny, yes.
Daktari, Mama John.
Yes.
So let's come to that thin line between the spiritual and the scientific solution to mental health. Tondu gwiciria handu hau ni hakunderu muno na nituraga kuha address.
Thank you, nĩ tondũ wa hau. Mental health rimwe nĩyagaga kũiyũkio wega na ũgakoraga mũndũ nĩ tondũ nĩ mũkristiano ndarenda gwĩtĩkĩra atĩ ena thĩna wa mũtwe na nĩagĩire na chemical imbalances no ndarenda gwĩtĩkĩra na arenda kuona nĩ ndaimono imũnyitĩte na nĩ mũroge na nĩ mwĩke maũndũ marĩa mangĩ. No nĩ wega kũmenya atĩ ti maũndũ mothe makoragwo atĩ nĩ ndaimono ĩrehire. No ũkorwo wĩna thĩna wa mũtwe nĩ tondũ your chemicals are not balanced. Na nĩ wega kũcaria ũteithio kũrĩ ndagĩtarĩ nĩ tondũ when you have the chemical imbalances, there's nothing else that is going to help. Nĩguo Ngai nĩ atũhonagia, but the medication approach is the best. Nĩguo chemicals icio ciũke. Niĩ ndiregaga nĩguo Ngai nĩ atũhonagia na nĩ atwĩkaga maũndũ manene. No nĩ harĩ kĩrĩa gĩatũmire nake Ngai ahe mũndũ ũũgĩ wa gũthondeka. Na hau niho tuthiaga tukauga atiriri niguo ni ndarwara na ni nginyite haha na ni ndiretĩkia Ngai ni ekuhonia no hihi Ngai no agerere harĩ ndagĩtarĩ na akuhe ndawa no thondekwo the imbalance icoke kwagira. Na koguo reke tutige kuigua guoya njugire ringi wona warwara mũtwe ti korogwo. It is just your organ that is not functioning normally na twĩtĩkĩre ũguo. Ũndũ ũrĩa ũngĩ nĩ spiritual health. It helps. Kuthoma kiugo kia Ngai, kuhoya. Nĩ tu incorporateaga maũndũ mau mothe na rĩrĩa treat andũ na tukagĩa na chaplain counseling. Mũndũ agathiĩ na akarĩrio nĩ chaplain kana na the psychologist. Tondũ depression can be treated in 2 different ways. Nĩ kũrĩ na talking na nĩ kũrĩ na medication part. Talking is a therapy and then medication igoka. At times you may require to have the therapy, just the talking. Na egoteithie mwaraniria na psychologist, mwaraniria na a priest. Agoteithie kuthie through the process and you may heal out of that. No he hindi kinyaga, you cannot just depend on the therapy. You have to take the medications to get well. Na kuo hau niho turokira reke tunyitanie tuoe undu uria kuri twĩtĩkĩre atĩ nĩguo ndĩ mũrwaru njarie ũteithio o Ngai akĩndeithagia.
Wow, thank you so much. Ririkana atĩ ũngĩkorwo wĩna kaũndũ ũngĩenda kũria kana kũgweta namba citũ cia thimũ nĩ tũhingũrĩte na tondũ tũtigĩtie ndagĩka nini mũno rĩ mũthenya wa ũmũthĩ uma introduction na nĩ tũgũthiĩ na mbere na kuoya ikinya rĩu rĩngĩ nĩgetha tũmenye the other things that we need to handle thĩinĩ wa kĩndũ gĩtagwo mental health. Can blood sugar level cause brain anxiety? Kĩu nĩ kĩũria kĩorio nĩ Rachel.
Nĩngũcokia kĩũria kĩu. Blood sugars, sukari waku rĩrĩa ũthiĩte thĩ kana ũgathiĩ igũrũ mũno, it may affect your chemical imbalances again. Na no ĩtũme ũgĩe na kĩndũ gĩtagwo psychosis. Ũgĩe na indo twĩtaga delusions, ũkambĩrĩria kũgĩa na maũndũ matarĩ ho kana gwĩciragia maũndũ matarĩ ho. Psychosis ũkagĩa na indo twĩtaga hallucinations, nĩ ũraigua maũndũ matarĩ ho. That could be affected nĩ tondũ wa gũkorwo sukari waku ndũrĩ harĩa wagĩrĩire nĩ gũkorwo na ũkagĩa na mathĩna nĩ tondũ ũguo.
Now,
and of course any disease let's say like if you know like you're prone to low sugar, kind of high sugar, hyper or hypoglycemia, what happens in a case that will create a lot of anxiety. With low sugar, people go into coma. So that will automatically cause anxiety. Now anxiety affect of course it affects your chemicals, your brain chemicals. Any disease. Any disease. Like right now, when we are talking of COVID-19, what is it doing to people? People are becoming paranoid. And paranoia, of course, is part of the mental health. We're becoming paranoid. And that is actually why I was saying even some people are wearing masks to bed. Others, you find somebody walking in the field or driving a car all by yourself and you have a mask on. For what? That's paranoia. Cause depression, anxiety. Sorry. Yeah.
Thank you so much. Uhoro wigie. I don't know whether we should mention or repeat the triggers. What triggers? Niki kiugiakagia tondu mundu normal, then all of a sudden ni athie. The latest case ni mundu rathire arathesha mutumia aracoka roya ngari aramiombora ihenya aramikia mutito-ini irahia arakua aroyo ni thigari aratwarwo mochari. Then what next? There are some other very sensitive cases. So can you mention on the triggers, and maybe out of that not tumenye kana kwina some preventative measures, and maybe you can join.
Depression no itreatwo na ukorwo kinywa dawa, and some people do very well, and after some time they may stop taking the medications because they are doing okay. No ni kuri andu angi makoragwo makiriquire lifelong medications ni tondu once matiga kunywa dawa ukona mundu ucio ni ambia kugia na anxiety ya muthemba, ni ambia ku behave kaundu funny. So some people may require medications long life. And depression, mundu wahonire wa ringi wanyuaga dawa na akigua ni ahona na agitiga kunywa dawa, depression no occur again na agie na thina na no itrigo ni undu wa kaundu hihi kanini. Maybe the first occasion mundu agire na depression ni tondu wa situation ari acoke athie kore ningi ni agia na situation almost similar to what made the first episode to happen, or something even different. Mundu ucio ugakora ningi depression ni acoka and they are requiring again to start all over again taking the medications. Koguo kuri maundu maingi muno magitrigger otoria tugire. No ukore hihi mundu ucio they were doing very well, ara lose nyumba, ara lose wera, ara lose, like right now so many people are losing mawira ni tondu wa COVID. O ikorwo hihi mundu ucio ni anyuaga dawa na agithia akihota gusettle na agitiga kunyuaga dawa tondu ni iguire ni igua wega na akihota ku handle life wega for some time, but now again comes the COVID pandemic, ni lose wera na ndari hahota gu support kana guikara uria araikaraga, ndari na mbeca iria aronaga, ndahota guthie shopping uria arathiaga, ndahota guthie gwika maundu maria arekaga. The life is not normal again. Ugakora mundu ucio ni ekuremwo ni ku handle the situation, ningi igatrigger depression.
Now this is very interesting. Wabere ni turerwo, in fact ona mundu gwitwo Mwangi atwira atirire, mundu gwitwo Mwangi kana Martin na ni amugeithia muno na ni guthoma SMS kana messages ici haha ciganona. Then mental health has been seen as a taboo topic in Kenyan community, and thanks Captain Njihia and Njihia Wakuri and Daktari, thank you ma'am for addressing this, a time to face the inevitable reality about this illness, especially among the young, is now. Are we a kind of underestimating the facts? Are we covering the face and failing to face the whole issue? And then we come in when it is too late. Mundu akakua, mundu akeruta muoyo, tukoiga atiriri ni ndwari ya kahinda kanini. Mundu akeruta muoyo, but ona mathiko-ini tuika ni culture itu tutikwenda kuga kiria arekire. No andu ni maramenya, one, ni kunywa aranyuire dawa, kana ni gwiciuria arecuririe, kana ni kwiguthithia arehuthiririe ngari, kana areikirie iria-ini. These are things that are very depressive, even the minute I mention them. But is it time that we need to face this? And where is the help for somebody who is listening to us right now? And he or she...
I think you were a captain. There is, Ona, I think you're hiding it. We are now somebody commits suicide, somebody ODs on some crazy medications. Then we are told what? They were dealing with some illness and they succumbed to short illness. Not really. Before maybe we get there, what bothers me the most, when somebody commits suicide, then somebody agoka koigatiri manane dironete. You see, that to me bothers me and goes very far. Okay, one modo ni depressed. One modo ai nidiramuonete mundu ucio kamuthire karia arathia nako ri ni aratigite guthie kanitha ndarariaga wega ndarekaga ABCD. Then when they commit suicide, you come and tell us that ni urari na kaudu ni uronete kaudu takauguo. So you see, I think, or I don't know whether it was yesterday that you said gukua ti guthie gucera.
Yeah.
Gukua ti guthie Kenya ati ni ugucoka oende gioco okay. You see, if you see something, number one, we are failing to see the triggers. We are failing to recognize depression. People are getting depressed, yet we are not catching it early. But I wish corona tutagathe. You see, especially for the young people, depression, suicide is killing us more than cardiovascular disease and diabetes or other illnesses are killing us. Kugo no wega tumenye nigetha at least hote guteithia andu aitu. I think where is the help? We should gutigira the expert.
The help, mundu wa mbere uria muno ungiguteithia wega ni your primary care doctor. No mahote ku manage kindu ta depression, akuhe dawa, aria nake. Ni wega gukorwo na ndagitari ungihota kumirania ngoro nake no kamwiraga how you feeling. Na nijui ndagitari ingi ni maroraga the well-being of a patient. Riria mathi na makarora maundu kana ni magakoma wega kana ni mararia wega. They're just trying to check kana wina underlying depression na hihi ma detect wina undu tocio. Your primary care doctor no hote kuambiriria dawa. Mundu uria ungihota ku reach out ni the psychologist. If you do not want to go the medication route, saria a psychologist. No arie na your primary care doctor refer to a psychologist. Uria mukugia na one one talk uhote kumirania ngoro nake umwire how you're feeling and they'll follow up with you. The other person is, if the psychologist doesn't work and the PCP, the primary care doctor, doesn't work, we have the psychiatrist. Acio nio mekuhota gukumanage wega na dawa. Na ni kuri na so many places that you can call. Ni kuri the National National Alliance of Mental Illness. There's a very nice website. They have very good resources there. No hote kulan maudu ma mental illness. and you have numbers that you can call, doctors that you can reach out, that is one of the greatest resources that you have. Even in our Kenyan community, we have psychologists, we have people who can help out. We have our very own Dr. Penny. She's very good. She's a psychologist. She's very good in offering the talk therapy. Na ndeciria ndĩrehoka atĩ tũgĩthiĩ na mbere na maũndũ maya, more doctors will come out or more psychologists will come out in our community na nĩguo tũhote gũteithia our Kenyan community. You can also reach out to me if you want to talk to about any mental illness. If you have any question, you can reach out to me and I'll be available.
Thank you so much. Thank you. I'm putting the website, NAMI.
NAMI, National, yep.
Yeah, I'll put it down there. Yeah. So there's so much that we can talk as we continue. Na tondu mathaa ni mathire fio, are we failing? Hena mwari wa wahome oria tiriri uyo Minnesota. Oria tiriri, are we failing to see the triggers, or are we choosing not to deal with the situation and hoping it will resolve itself, or it resolves itself by itself?
I think it's both. I think we are failing to recognize the triggers, kana recognize depression when it's happening. Na mahinda maria mangĩ twa recognize tukaga kuhota gukinyira andu aria marabatara ũteithio, na kana mũndũ ũrĩa nake ũrathiĩ through it akaga kucaria ũteithio, akaga kumĩra na kuga I need help. I think it's both ways.
Thank you so much. I don't know kana hena kaundu kage agikorwo he kaundu kage tungi gweta muthenya wa umuthi, hihi no toge kurikia mothe agikorwo wi hau na no wende kuria kiuria uri ukwendete kuhura thimu riu no ahure thimu, onokorwo ndiramenya andu aingi muno ni metigagira kuhura thimu. I don't know why we are dealing with something that is affecting the people, but mathaa namo matigetagirira muthamaki. But it is important. What do we need to observe or to watch out for? We mentioned, kajiwe Captain Yaroiga atia ni dona thimo ha. Hello?
Hello, Jambo. Ni Captain ha ai.
Yes,
George.
George.
Gatho ni ndo platform yo. Mwatu he na dagitari sokeria dagitari Jen Njihia wa Kuria for the good work. Ni makoretwo manyitĩrĩire the young community here gũkũ gwitũ. Maruta wĩra mwega mũno, so nyambe ndĩmacokerie ngatho. Julia Terere, can you tell when we're depressed through maybe some dream sign of depression? No corona iroto, corona kiroto ikitia mũndũ wĩ kawaida wĩ normal. Kwĩ andũ marotaga magĩthiĩ, kwĩ arotaga makiuga mbu. Also, can work schedule make you get depressed?
Okay.
So those are my probably not one tarito mortoni no korwo. They are triggers to depression, so we probably might need to know.
Thank you, George.
Mono na dimetaboine.
Thank you.
Thank you, Captain.
Thank you, Captain, nĩ ũndũ wa kĩũria gĩaku. Concerning iroto, no ikorwo irarirĩte na maũndũ marĩa ũrathira through during the day. Na ũkorwo hihi nĩ wĩna meciria maingĩ mũno. You have so many things that are depressing you. And when you go to lay down and sleep, that is what is coming through. Na hau niho tũroragĩra kana wakoma wokĩra rũcinĩ nĩ ũraigua wĩ mũnogoku. Nĩ tondũ hihi maũndũ marĩa ũgũthiagĩra throughout the night, you did not have a restful night. Or maybe they kept you awake, but they have been demonstrated kana iraumana na kuma meciria maku, how active your mind was during the day, and now it's reflecting in your dreams. So ugakorwo no agwo no pay so much attention to those things. They could be telling you, hey, they could be the red flags there telling you, hey, you need to slow down and do 1, 2, 3. Ugakorwo ni irakinya nginya gukorwo ati you're dreaming about it, and maybe it keeping you awake, where to a point where you're even sleepwalking, or you're talking to yourself in the sleep. And if you look behind, if you check yourself well. Maybe there are the things that you are fighting with or you are working on throughout the day. That could be a sign like, hey, this is becoming too much. I need to slow down and do 1, 2, 3. Mm-hmm. The other question, you makanawera no cause depression. There's something that we call situational depression. The circumstances surrounding you could be causing the depression. And you're not being able to handle the kind of work that you're doing. Maybe the workload is too much for you. The kind of the job that you're doing is not favoring you. And you find yourself, you're having something that we call situational depression. Situational depression, no, it is because pandemic. So many people are getting situational depression because of the situation that they are in. Now, there are so many types of depression. To give you to break down, but yes, it can cause depression and function as you're supposed to be functioning.
Thank you so much.
The other thing about work schedule that we can talk about is, of course, we all like doing what? Doubles and triples. What does that do to you? Messes up your sleep cycle. Now, the other thing that it does is that you become sleep deprived. When you become sleep deprived, of course, you're not giving your body enough time to recuperate. That can actually affect you. Prolonged fatigue is not good for the body. That is when you hear people marare na breakdown. And I think that is what our university students back in the days, I don't know whether they suffer that today, that is what they were suffering from. Ronaga mundu ni athie ni athoma kinya handu agate bao ateaga bao. It's that because they are so much sleep deprived. Ginya mundu akiria mwiri ugakiria otherwise.
The other thing is when you're working too much, it means you're not having time for yourself. You're not having that time where you can interact with other people normally outside your work. You're not having that self-care. We talked about self-care. You need to check yourself every day and make sure that you're taking care of you. You have your you time. Na riu wakorwo ni urakiruta wira muno captain ri ndugukihota gukorwo na me time kana the time to socialize with the other people, which plays a big role in your mind too.
Now, actually, she mentioned something that human beings, we people, we are social beings. Now, sometimes you see the reason why there is so much depression here is because what we call individualistic life. Yeah. We do not live as a community. I could pass by my neighbor's house without making without even letting them know. And todo mugeni ni okire. So but that one nagahota prevent I'm able to call my neighbor kind talking about nothing. If there's anything like that, you talk about nothing, but there's no therapy talking about nothing. Now if we that are here do not have those small communities where you can sit with people and talk about nothing, then we are going to get depressed. So get together with your people, get together with your friends, do nothing, talk about nothing. That is enough therapy. We are social beings. If you're working too much, then you may not be able to interact with other people. But that one of kugia na guikarania na andu na kwaria, that is therapy. Nikionaga gicagi kwanyu ngirwo mundu urukite no agocio wathire university na gutuikaga kurukire ni guthoma. Of course, there is also another thing that maybe we didn't mention here. There is also genetic predisposition, mental health. If you have of course, a relative, you know, wikagati oteaga bao, then you're also at risk for such. Those are other than what we are talking about, the other things that we talked about.
This is the Trumpet of Hope, Karubeta Kamwehoko, and we are giving you an opportunity to learn, an opportunity to feel encouraged, an opportunity to feel entertained, an opportunity to feel motivated. Ukimenyaga ati gutire mundu ungi uhana tawe, we waciarirwo wi wa goro na wi wa magegania, and you should never lose hope. It is never too late. We should not give up. In the studio tonight, ni andu a magegania muno, the doctors Paul and Jen, Jen and Paul Njihia, kuma kundu gwitagwo Indiana. Now, Yvonne Heudoiga, na dikwenda guthita all these yurishi. I have about 3 questions that have come up, and then we wind up. The problem is that people refuse to accept mental illness as a disease, and therefore refuse to educate themselves on it. Then something happens, and it is too late. There is also shortage in the resources, especially in the Americans. America for Black people, because of the stereotypes, and I want you to underline that. Stereotypes are surrounding us as Blacks, Kenyans. Don't be discouraged, but don't be discouraged. Keep look out, and you are bound to find someone. Can we talk about the stereotypes a little bit?
Yeah.
I like that.
You wanna go? Yeah.
About the stereotype, mostly, I don't know how to put it.
No,
stereotype, yeah.
Nĩ ũkoyo andũ gatwĩkaga ng'ania nĩo marwaraga. Aya nĩo mahanaga ũũ nĩ tondũ nĩ a mbarĩ ĩno kana nĩ a ũũ. Ũkoyo ũgatwĩka atĩ tondũ we wĩ mũirũ, so you're prone to kũgĩa na mũrimũ wĩtagwo schizophrenia nĩ tondũ ũrwaragwo nĩ andũ airũ. O ta ũrĩa tuonaga kĩndũ ta mũrimũ wa diabetes, andũ airũ nĩo meragwo nĩo marwaraga mũno. It's there with the white people, but warora andũ airũ nĩo meragwo nĩo ĩno nĩ mĩrimũ ya andũ airũ. Mental health ũgakoraga nayo nĩ ũgũkora schizophrenia na mĩrimũ ta ĩyo nĩyonagwo mũno itarĩ mĩrimũ ya andũ airũ kana andũ arĩa mekaga ũũ no. Na tũkaga ku pay attention kuri what is really going on, tukahe andũ diagnosis kuringana na kuria maumite kana na uria maikaraga. I don't know whether I'm coming clear.
No, and of course, I think that was Yvonne who brought up that idea. Thank you very much, Yvonne. She's one of us here in Indiana.
Wow.
Yes. So, there is little to no resource, especially to us who have more melatonin in our skins than the other people. Gushiria, and that is true. Todo maybe when you're seen somewhere, I don't know, already ne mago tuile sira ne magire this person yahana or no, maybe they will not be able to pay. I think that is what affects the or what causes the lack of resources. The other people, although it could be true, although sometimes when I do it, at a different level, and I may say that and then get some stones. Personally, the way I and of course I know it's especially anakeitu todo maragethie mono haria mari makonwo ni ukora. But again, tutige gukuo ni kiundu kiu, tutige gukuo ni kiundu kiu. Oko ni kiri urenda ri, oko ni hari urathi, oko ni wathi thibitari ri. Reke tuthie tutakuite undu ucio. Nĩ wega gwĩtĩkĩra tũrĩ airũ no ũtigae kwĩona wĩ mũirũ kana wathiĩ handũ wekwo kaũndũ gekwo kona mũndũ aragwĩka ta wĩ mũirũ. Ona ithuĩ tũtige gwĩ stereotype, nĩguo ingiuga tũtige gwĩ stereotype. twathi handu oko ni right yaku ri make sure no wage ni right yaku na no wa mimiti na twitikire atiriri tutige gukurumira rungu tondu andu itu kiu nikio gituthukitie gukurumira rungu ni atiriri ni twaregire kwambambatira wakara na mentality yo ya mundu uri ati tondu guku na ithwe andu aitu ni twambiriirie guthie gwikaga na ndiraiga ni uru no na ndirakiria uria hihi mundu angikiuga ni twambiriirie guthie kuoyaga food stamps na ni twambiriirie guthie kuingira ma section 8 na maundu macio mangi wekira mentality yo ati uria wothe urekwo kuriguo ni tondu wi muiro then ni ukwaga guthie na mbere wathie cukuru kana wathie kuria wira waga kwandikwo uroiga ndaga kwandikwo tondu ndi muiro wathie gwika driving waga kuhituka ukaiga to wagwa ni tondu wi muiro no waga weka mahitia maria wikite weka ri kana waga gugithoma ri ndigwiciria ni ukwandikwo tondu wi muiro mundu uria qualified yage kwandikwo ndiraiga uguo ni tondu wa atiriri ni njui ni qualification ciaku igutwaraga haria urathie na kuma haria njikarite ri ndiraigua ati ni njagite kuheo wira muna ni tondu wa ona accent kana ndi muiro tau field ire tukoragwo ri tuthiaga twandikaga na tugikoragwo iguru ya andu aria tu supervisaga ni andu aria me guku na ndaigua ati ni ndiratreatwo undu muna ni tondu ndina rangi mucamu ndikana ndirari uguo koguo stereotyping rimwe na ithwe ni twikagira ho niguo ndenda kuga ni ndirora kamera-ini
yeah, it's all right na ni njugaga wega muno ndukanamenwo nawe wimene.
Yes.
Yeah, ndukanamenwo nawe wimene. Thank you very much Yvonne. Ndina ciuria ciganona. One, like how ugu ha stereotypes na andu kwaria kana andu kwimena na andu kwaga kumenya go professionalize uhoro uyu wa mental health. It is not ti kaundu ka bari na kana ka andu ana. It is an illness. Ni umenya tene tuigaga atiriri ucio tigana nake ni ateire mbao. Tuona mundu akirogota maratathi tuigaga ucio tigana nake ni ateire mbao. Ucio tigana nake ni akire ona. Tuona mundu aguruka, in fact reke huthire kiugo kiu, mundu aguruka tutionaga tari murimu ta uria mundu angituika ati ni arwarire cancer kana ni arwarire murimu wa cukari. Tuonaga kuguruka tari undu utari wa kawaida. Na it is diuria tugeka nigetha to professionalize undu ucio tige kuona mundu tondu teru hihi hena mundu ratuthikiriria and maybe you are going through depression, maybe uratuthikiriria wi hau na ni uranyua dawa, uratuthikiriria wi hau na ni urona ndagitari, uratuthikiriria wi hau na ni urona psychiatrist kana ni urona counselor kana ni muraria na mutungatiri wanyu ni tondu wa maundu to maya turagweta. I don't know. Let me become a little bit home and encourage somebody that the people we are talking with right now, they are there to help you professionally and medically and even spiritually. Nigetha ndukae gutuika ati ni ugukinya muico wa muturire na wi hau na ni uratuigua. It is not the end of the road and you're not abnormal. You're not abnormal. You are just going through a short health issue and there is medication, there is health, there is hope, there is help somewhere. Now, this I know people are discussing this and I love the discussion. We have some professionals who are discussing this and answering people even on our text messages. Oh, you're following, eh?
Thank you. Yeah, Shiro Karanja and Anastasia Jerry, of course Yvonne is helping and the others, yes.
I love this. So ndiramenya nikiri kuguria Shiro Karanjoria, mental health is our emotional well-being. Okay, hena kiuria ekoriti hau bere. The difference.
Gwishira kiria captain let me gwishira there is something that is going on. Hemu do riria tiriri. To differentiate, especially young people. How do we tell the difference between laziness and mental illness kana
Oh,
mundu
yeah, I
uratuika
see it.
depression.
Nĩ ndona kĩũria kĩu kĩa mũndũ wa Dubai.
Gwĩciria kĩu nĩkĩo that is one of the issues ndĩrona gĩgĩthiĩ hau ũguo mũno, especially the young people. Na nĩtũĩ there is think arĩa tũkĩrĩ na ciana ici nyinyi tuonaga mwana nĩ egũkoma mathaa 12 okere arĩe acoke athiĩ toro.
So how do you differentiate?
Maybe gwĩciria no wega kũmenya ũkona atĩrĩrĩ tondũ I think no wega gũkĩgĩa na watho tondũ rĩu mwana ndangĩgĩtindaga toro, no wega agakĩheo mawĩra marĩa kĩrĩa, na gũkũ nĩ kũru. Let me say that, reke nyambĩrĩrie kuga hau ũguo, gũkũ nĩ kũru ta kũrĩa twathagwo, tondũ ta ithuĩ twarĩ na ng'ombe, twarĩ na mbũri, ithuĩ baba angĩokire akore mbũri kĩania, nĩ tũkuga nĩkĩ tũreka nyũmba, mbũri kĩanagia nĩ kuga itihetwo mahuti, na same na ng'ombe. No rĩ gũkũ rĩ twĩ apartment, rĩu rĩ mwana rĩ gũtirĩ na ũndũ wa gwĩka, rĩu na rĩmwe moragia atĩrĩrĩ nĩ atĩ ũngĩngwĩka, tondũ ndĩratinda ngĩũria my 15-year-old what will happen between now. Gũkũ nĩ mararĩkirie wĩra wa cukuru ira mweri 20. Now my question is between now na nginya August cukuru ihingũrwo okorwo nĩ ikahingũrwo rĩ, mĩeri ĩno yothe rĩ nĩkĩ gũkorwo gũgĩkwo? Rĩu okay, mwana akũria atĩrĩ rĩu rĩ nĩ egũkoma rĩngĩ agakoma thaa 8 arĩũkĩra thaa 9 cia mũthenya ũyũ, no rĩu wamũria akũria atĩrĩrĩ gwĩka atĩa? Anyway, wega nĩ kũrora nĩ atĩrĩrĩ, no wega nĩ kũrora mwana ũyũ rĩ hena ũndũ ũngĩ tiga rĩu gũkoma kũu rĩ, what else? Tondũ gũkoma gwika rĩ it does not constitute to mental illness by itself. Gũkoma atĩ mũndũ nĩ arakoma ũguo ndigwĩciria that can be defined, or it does not meet the diagnostic criteria ya depression. But there are other things. There is something that my wife mentioned in the beginning. When people are becoming depressed, their problem-solving skills changes. Okona modo who was very sharp, they were able to handle issues, but Okona, all of a sudden, they are not able to solve the kind of little things they are upsetting them. They become very irritable. They lose their self. I mean, their skills, problem solving skills. So there has to be now a cluster of symptoms, a cluster of things that are happening. Maybe they're depressed. Of course, there is some big people become very emotional. You talk to them, you say hi, kana moriani kiureka, ukona ni abiriria korera. Ukona ni ara withdraw dareda kuona ni dareda moikaro goreda dareda ko even they are not even making face contact. Mundu muramenya ta kwaraniria riu dara kwariria. But again, if they are sleeping, they are okay. When they are up, they are joyful. They are interacting with you. Then on the other thing, as you if somebody quit wera or remove kana arega guthie gwika maundu maria ekaga, then that's a red flag. I think those are that are in the mental health are told. Then mugiona mundu mukuru urare na kagui na niakendete niakaheana kana niambiria guka abuse riu no maingĩ weraga ona muno ta oko ungiona mundu ena kagui one niakaheana na niambiriria kwigaya umenye ucio niki arorete kwiyuraga. Just some of those things. Riu koguo niguo ngugaga maybe with the young people there could be other things that to give a depression. No gukukua ne kurito todo. There is really nothing to do, especially right now with COVID-19.
Now, thank you so much. Hena kiuria gikuritio na ngwiciria giki nikio tukurikia nakio. Let's finish with this. Mundu gwitwo Shiro wa Karanja. Thank you.
Shiro Karanja, yes. Thank you.
Shiro wa Karanja. Nitukurora horo ucio. Thank you very much. Mundu gwitwo Stella Mosetti. Can technology cause mental or physical health? I mean anxiety and stress. Nikuhingana indo ici ciothe, please. Tukirikia. And you can mention
I can tell you, actually, there's a new diagnosis called screen addiction.
Can you please explain to us?
It's one of the addictions.
Yeah,
it's one of the addictions.
It is an addiction. Wow. Screen addiction is a new diagnosis. There's an ICD-10 of that screen addiction. Yes, it is an addiction.
And we need to know how to maybe prevent that kana nigetha ndigake gukia baba tire twike ningene agithie muno, and especially no mia kure ndo maikaraga gutire kaundu kangi twika ni uraro ciana and mwana ukimuthengia thiini wa cartoon akarira tondu that is what he knows, and we want to know even how these things will affect the next generation, whether for the positive or negative. But there's something else. The difference between mental health and mental illness. Kiuria kiu gikuritio ni Shiro akara. Kana undu cio kugwetetwo ni Shiro. Onokorwo ni wagicokio in the process. I don't know. Riu nie
Negusoko hau ringi. Mental health tugire ni hindi ria urahota ku function. Ni hindi ria meciria maku marahota ku handle the situations as they come. And all of us, we have mental health. The problem comes in when your mental health is compromised and you get the mental illnesses.
There we go.
So mental health is when you're functioning, when you're normal. Captain, you're mentally health. But when you get compromised, kana wagia na thina wa depression, na anxiety, na maundu mau mage mothe, that's then you have the mental illness.
Now, gwiciria mundu umwe ni ekugite atiriri. So what do we do to promote mental health and prevent mental illness?
Number one is self-checkup. How you're doing, how you're dealing with stuff as they come, or how you're doing things. If you notice a pattern of, hey, I'm sleeping too much, I'm sleeping too little, I'm not able to stay asleep when I sleep, I'm usually waking up in the middle of the night. You're worrying so much, or things are keeping you awake. That's a red flag. Check on all those things that we talked about in the beginning. We talked about the mood. Check about your mood. Are you feeling so anxious? Are you having guilt all the time? Are you feeling hopeless? Are you having mood swings? There's something that we call bipolar. Your mood is, you cannot say that you're stable. Your mood, you're either up or you're down. You're either depressed or you're manic. Manic, you cannot even sit still. Your mood is going up and down. So check your mood, whether you're having guilt feeling, whether you're having anxiety, and whether you're having the feeling of hopelessness. The other thing is check your behaviors. How are you presenting? How is the person presenting? If you're suspecting that your friend or your family member is having depression, how are they presenting? Mm-hmm. Are they getting agitated? Are they getting excessive crying? Are they worrying too much? Are they becoming irritable? Are they becoming restless? Those are the things that you're supposed to check in the mood. And then in the sleep pattern, are they sleeping well? If they're not sleeping well, is it that they're having trouble sleeping, falling asleep, or are they having trouble staying asleep? Mm-hmm. Are they sleeping too much, or are they not sleeping? Because that also is going to affect you. The other thing that we talked about is cognition. How is their memory? Mm-hmm. You find somebody who was doing very well, they're becoming very forgetful. And you also find they're becoming so slow in doing things. Mm-hmm. They are having something that we call psychomotor agitation. They are moving so slow. Mundu urendete gutengera ona riu ndendaga maundu mau. Okorwo nĩ maundu when you're doing things in your house, when you're doing your chores, they may take so long to do their dishes that they only do maybe within 15 minutes, but it may take them longer time than what they usually do. So pay attention to such stuff. The other thing is, are they voicing suicidal thoughts? By voicing suicidal thoughts, they're saying, hey, I would rather be dead than living. Or maybe my family will do better if I'm not around. Things like those. Or are they homicidal? Are they thinking of killing somebody else? That's another thing. And then the last thing that we talked about is about your weight and your eating habits. Check whether the person is eating well, or are they eating too much, or are they eating less? Their appetite is poor, which will cause, if they're eating too much, the weight will go up. If they're not eating, the weight will go down. And so those are a few things that could be the red flag and could lead you to notice that somebody need help or something is happening.
Thank you so much. And I like it when Modogoto Shiroa Karaja, she is writing and very important points. And we can extend this next week. Can we even look at the what to avoid, like a food? Is there an issue with the food to avoid when you're depressed? The language, Modogoto and Modogoto Shironi Donagweta, about language as safety. And Nia insists, there are people who don't understand the terms and also use the word mental, which can cause triggers with the people. And then, thank you so much. Emphasis on the passive suicide ideation and active suicide ideation. Can we promise to continue?
Yes. No, you have to, I don't know. You tell us. And of course, yes. Are people willing? Because some of these are not the hot topics. I think we'd rather listen to Kamaro and Wamobe and the others than listen to this.
That is on Friday. On Friday, yes. When we have our Mogithi. So that is the night that we go to Njihia Hawaii. Natoka
tomorrow,
Roshio. Natodo muthenya ucio wi hori. This is very interesting. I see. Zedizina talked about screen addiction is a worry to me because my son doesn't get off his eyes from TV or phone. I would wish to know the easiest way of stopping this without affecting him. So you see, people are interested. Yes, we can continue this one next week. Now, I want to hear these things. Please, my friends, when I bring a guest in the studio, apart from writing the questions, I want people to call in, because that way we feel we get to interact. We are here following. Keep going. We cannot keep going today.
Maybe she's at work. Becky, I'm sure you're at work. Huh?
Is developing high appetite a sign of depression?
Not always.
Anyway, you people, we would want to proceed on, but and then maybe next week we'll proceed on this. Nigetha tuhane ta tuguthie deeper hanini. Tono twende kinyagia ku dissect riu tuke bipolar. Tumenye what is it?
Schizophrenia na schizoaffective disorder.
Jesus Christ.
Huh?
We can also talk about personality disorders.
That is a
By the way,
one.
Do you know antisocial disorder?
That's a personality, right?
It's a personality disorder. Kuri andu matendete andu.
Na kuri andu mendete andu muno.
Anyway, so some of those, I think we can do that. We can do that.
Lot.
Then, but again, Captain, I think this is good to know. Like we were told, all of us have a degree of what? Madness or craziness. It is only that the degree varies.
Rutimenyaga saying you kana nearly peer reviewed.
Very peer
I don't
reviewed.
think so.
We all have a degree of, like they say, if you can talk to yourself, all of us do, eh?
Yeah.
But if you answer yourself, that means you're crazy.
Riu ni tari woguo thaa ici na mwandiga right now ni ndiramuona ni turaraniria and then mwehera hau ri gutigwo hanjikarite ndiri o wiki na ni ndiratheka na
wehariria no weharirie no ndugecokerie
wi mwega
wehariria na wicokerie we ni wate mbao
riu nona riu is it peer review?
That is evidence based.
Aya ni wega andu mararega kuhura athimu tondu oh me wira captain okay unamenya riu no ni marekaga tondu marandika. I love it when people write and since our different time zones ndanageria uria tukurehe program rucini no ngakorwo na mathaa ma rucini ringi na niĩ niguo ndirathie kivarua riu no ni tugukirora, but I think we all have a degree of depression. I think it depends on how you are able to cope with the situations. That I guess that's a closing.
That determines your mental health.
Okay, that is Leah Martin. We all have a degree of depression. I think it depends with how we are able to cope with that. And the doctor says that is mental health.
Yes.
All right. Ugaicigo cia mwisho. Personality disorder. Can't wait to learn about that. Na hena mundu oiga antisocial. Aha. So next week.
Next week. No, thank you. I just want to take this opportunity to say thank you for our viewers and our listeners, wherever you are. Thank you for listening to us, and with the little knowledge that we shared with you, we are hoping that it's going to take you a long way and that you're going to implement that. And we're hoping for more platform that we can educate people. And if you have any issue, if you're feeling depressed, if you're anxious, if you're feeling suicidal, you are hopeless, you have come to the end of yourself, and you think that you cannot do it, know that you're not alone. We're here to help you. We're here to walk the walk with you. So don't walk alone. We are here for you. We are phone calls away, and we will do as much as we can to help you so that you can conquer this and continue with life as you would. So thank you again for our viewers, and thank you, Captain, for hosting us.
Thank you.
And to my husband, thank you.
Yeah. So thank you very much. One thing I would like to say is that we are not the experts. So if we say something that you didn't agree with, it is okay. It is okay because, like, you know, this is of course, it's not an easy topic. But again, instead of blaming or pointing fingers at us, please make us better. Again, we are not experts. We are just trying to raise our voices as we, talk about this topic, which, of course, nobody wants to talk about. But again, I'm sure that you learned whatever you did. There's a lot of information online that we can all search. But again, what I would like to say is that we support each other. Support me, I'll support you. Be available for others. And if you're available for me, I'm available for you, then our world will be better. Let us be available for especially the young people. Support them. Let's change what was passed to us. Maybe for me, I was never supported by those that were ahead of us, but I do not want to pass that to the next generation. I want to support, especially the upcoming generation, and of course also mentor them so that they can mentor those that are coming, including my kids. So be available for the young, be available for the old. Let's pray for one another. Let's support each other. tutire muciĩ twĩ kũnene mũno na muciĩ na tũngĩũka kũmenanĩra gũkũ kana kwa gũsapotanĩra gũkũ andũ megũthiĩ na no inyuĩ mũkũruta mbia cia kũmatũma kana cia kũmathika. So let's build a stronger community through supporting each other. God bless. Thank you, Jen. It's good to share the platform with you and also to learn from you, because I need to get better at this.
Thank you so much. I know we have so many questions that we did not address. I see Shiro Karaja wanted us to emphasize on passive suicide ideation and active suicide ideation. Maybe we can talk on those things. We'll keep note on all the questions and then we can tackle them next time.
Thank you. And if at all you are there and you're an expert, or you also work for the mental health awareness programs that we have, either for our community or even for the country or even for the government, we would want to have a forum. I know we are organizing to have Dr. Penny Njoroge also come in so that we can help and we can speak about this and we can know where to get help, either for a community or for the society. So as we continue, next week on Thursday, we will have another program. I know next week we have a lot of things to do, a lot of programs, a lot of people coming in next week. But on Thursday, we'll continue from where we stopped. And if you think or if you feel that you're a professional in any area, and especially the issues of mental health, I would really love it when you come and join Dr. Paul and Jen Njihia so that we can continue and clear and help our society, and this would be very good. So thank you so much and have a good night, Daktari, and say hello to the other members of the family, akina Aunt Mary Mary no tulioka kuria nduma na ngwacĩ na maundu macio no marikorwo me mega uguo cikare cikiroragwo biũ. Ndiraigua waje he mundu wandikire haha. I'm not able to go back to the message, but andikire ati it is only in your house that she feels when she comes, she feels at home, and that was very nice. And then the message andiketwo haha uguo, a comment that was sent by somebody. Wabui Wakamuiga, thank you very much, Dr. Jen Njihia and Njihia wa Kuria. Mudogo Thomas Godhiga, thanks Dr. Kuria and your wife for that good information. Aunt Mary Iga na kinyadari arakoma ndika niakete homework yake. Thank you, Dr. Njihia and Dr. Njihia wa Kuria and Dr. Jen Njihia. I have learned a lot. Thank you, and many others. We are good listeners. Thank Dr. J here and Jean, so educative. We love you. That is Nyambura. And you know what, by the way, before we finish, Nyambura had a birthday party yakana agake kairetu getagwo Princess. And
Princess, yes.
10 years. Yeah.
So we need to take this opportunity. We need to take this opportunity and wish Precious Jerry Wajaguna of West Hanover Elementary School. She's in 4th grade. We want to take this opportunity on behalf of all the Trumpet of Hope pillars to wish this precious girl a happy birthday. And Daktari, and mwena ma'am, mutike wish kairetu ka happy birthday.
Precious, we just want to take this opportunity to wish you a very happy birthday on your 10th year. We love you, and we like seeing what you're becoming, a good woman. And we wish you the best in life. We wish you God, and that He will take care of you and direct you in the right ways.
Happy birthday, Precious. May God bless you. Happy birthday.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Precious. Happy birthday to you.
Wow. Thank you. And we say, ha. Thank you. She means a lot to me. That girl, Makiuma Kenya, mami wao atigetia muthenya umwe agie mwana. And I was among the people who were complaining and saying why. And then she comes here, and the following day, she gets to labor and she delivers that beautiful, beautiful, precious, and she's a real angel, and we love her so much. And the mom says thanks so much. Anyway, bye.
Bye.
Thank you.
Good night.
God
Thank
bless.
you.